Diphenhydramine is an antihistamine that can be used to relieve symptoms of allergies, hay fever, and the common cold. It can help with symptoms like rash, itching, watery eyes, cough, runny nose, and sneezing. It can also be used to prevent and treat nausea, vomiting, and dizziness caused by motion sickness. Diphenhydramine works by blocking certain natural substances in the body that cause these symptoms. It can also help you relax and fall asleep. This medication is not recommended for children under 6 years old, and some forms are not recommended for children under 12 years old. It's important to follow the dosage directions carefully to avoid serious side effects. It's also important not to use this product to make a child sleepy. If you have any concerns or questions about using this medication, it's best to consult with a doctor or pharmacist for more information. When taking Unisom Sleepminis 25 mg capsule antihistamines, be sure to follow all the directions on the product package. If your doctor has prescribed this medication, take it as directed. If you have any questions, ask your doctor or pharmacist. You can take the tablet, capsule, or liquid form by mouth with or without food. If you're using the liquid form, be sure to measure it using a special measuring device or spoon. Do not use a household spoon because you may not get the correct dose. If you have a single-dose form of this medication, you do not need to measure the dose. The rapidly dissolving tablet or strip should be allowed to dissolve on the tongue and then swallowed, with or without water. The chewable tablets should be chewed thoroughly before being swallowed. The dosage is based on your age, medical condition, and response to treatment. There are many brands and forms of diphenhydramine available, so be sure to read the dosing instructions carefully for each product. Do not increase your dose or take this medication more often than directed. To prevent motion sickness, take your dose 30 minutes before starting activity such as travel. To help you sleep, take your dose about 30 minutes before bedtime. If you continue to have difficulty sleeping for longer than 2 weeks, contact your doctor. Be sure to tell your doctor if your condition does not improve or if it worsens. Some common side effects of Unisom Sleepminis 25 mg capsule antihistamines may include drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth/nose/throat. If you experience dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor if you experience any serious side effects such as mental/mood changes, difficulty urinating, fast/irregular heartbeat, or seizures. While rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it's important to contact your doctor or pharmacist. If you're in the US, you can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Unisom Sleepminis, it's important to talk to your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions, so it's best to discuss this with your pharmacist. It's also important to discuss your medical history, especially if you have breathing problems, high pressure in the eye, heart problems, high blood pressure, liver disease, seizures, stomach/intestine problems, overactive thyroid, or difficulty urinating. This will help ensure the medication is safe for you to use. Unisom Sleepminis can make you feel dizzy or drowsy, and can also affect your vision. It's important to avoid alcohol or marijuana while taking this medication, as they can increase these effects. It's best to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. If you are using marijuana, be sure to talk to your doctor about it. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you have diabetes, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid sugar, aspartame, or alcohol, it's important to discuss this with your doctor or pharmacist before using Unisom Sleepminis. Children may be more sensitive to the side effects of this medication, and it can often cause excitement in young children instead of drowsiness. It's important to monitor their reaction to the medication. Older adults may also be more sensitive to the side effects, especially drowsiness, dizziness, confusion, constipation, or trouble urinating. These side effects can increase the risk of falling, so it's important to be cautious. If you are pregnant, you should only use this medication if clearly needed and after discussing the risks and benefits with your doctor. For nursing mothers, it's important to consult with your doctor before using Unisom Sleepminis, as the drug can pass into breast milk and may have undesirable effects on a nursing infant. It's important to be aware of potential drug interactions that may change how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Unisom Sleepminis include antihistamines applied to the skin. It's also important to tell your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Additionally, be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's also important to be aware that this medication may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are taking Unisom Sleepminis. If you or someone else has taken too much Unisom Sleepminis and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, seizures, and dilated pupils. In children, you may notice changes in behavior such as restlessness, irritability, or hallucinations before drowsiness sets in. Always take this medication as directed and keep it out of reach of children. Make sure to keep all scheduled medical appointments and lab tests while taking Unisom Sleepminis 25 mg capsule antihistamines. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you happen to forget to take a dose of Unisom Sleepminis 25 mg capsule antihistamines, take it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed dose and take the next one at your regular schedule. Do not take a double dose to make up for the missed one. It's important to stick to the recommended dosage to avoid any potential side effects. When it comes to storing Unisom Sleepminis 25 mg capsule antihistamines, it's important to keep them at room temperature and away from moisture and light. Don't store them in the bathroom and be sure not to freeze any liquid forms of the medication. And of course, always keep all medications out of reach of children and pets. When it comes to disposal, never flush medications down the toilet or pour them into a drain unless instructed to do so. Always properly discard the product when it's expired or no longer needed, and if you're not sure how to do so, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.